Afternoon, everyone. I am Mrs. Marlene Peter, Associate Professor from Choithram College of Nursing, welcomes you all to the day 2 of our 5-day National Faculty Development Program, organized from 15 June to 19 June. I hope yesterday's session with Professor Dr. Grace Madonna Singh left you inspired and enriched. Today, we move forward with the equal zeal as we develop deeper into the implementation of the semester system. Yesterday, we have an excellent overview of the semester system, core competencies, curriculum framework, and implementation plan for the modules. I encourage all the participants to revisit their notes and begin applying their insights to your respective institution. The recording of this session is already shared in the YouTube channel and the link is already shared in the chat box. It is now my distinct honor and privilege to introduce our resource person for today's session, Mrs. Sharanya Pillai ma'am. She is currently serving as a Vice Principal at 𝐂𝐮𝐸𝐻 College of Nursing, Nagpur, Maharashtra. She is our proud alumni and done her UG and PG from Choithram College of Nursing. She is a fellowship holder in neonatology nursing from the National Neonatology Forum, a certified advanced neonatal resuscitation provider, and a national trainer for facility-based newborn nursing, a distinction that speaks volume about her clinical depth. She has served as a research project coordinator for PG students, a student counselor, and a senior mentor, and a resource person at numerous national workshops, conferences, and National Health Mission training programs. She has conducted 21 series of workshops on CPAP and basic ventilations and has published research in peer-reviewed international journals, including the International Journals of Science and Researches and the International Journals of Occupational Safety and Health. Her journey from serving as a staff nurse in pediatric at Choithram College to leading a vice principal shows truly professional growth. We are truly privileged to have her expertise with us today. Before starting the session, there are certain instructions to be followed to maintain the smooth conduct and to prevent harshness during the online mode. You are requested to mute your session, mute your phones during the session. If you have any sort of queries, kindly put messages in the chat box and we will discuss at the end of the session. During the session, if you want to unmute, then kindly use hand raise icons and we will unmute you. So I warmly request Mrs. Sharanya Pillai ma'am to address this gathering.
Very good afternoon, Marlene ma'am. Thank you so much for this great introduction. Am I audible?
Yes, ma'am.
Yes, ma'am.
Thank you, ma'am. It's really a very good afternoon to everyone. It's really a privilege to present myself in this on this great platform and in front of my teachers. Really very honored and privileged and very happy as well. I hope I would justify this topic what ma'am has given me. Ma'am, should I share the slide?
Yes, ma'am.
Ma'am, should I start?
Yes, ma'am. So,
okay. So today our topic is effective implementation of competency-based curriculum. So yesterday in the Grace ma'am's presentation, it was very clear. Ma'am has made it very clear for the participants how a curriculum has been designed by INC. And it is very, like ma'am said, it's very clean, perfect, and neatly designed curriculum. So today we'll be discussing how it can be effectively implemented in the for the students, as well as how can we make it easy for the students as well as for the teachers to effectively implement it. So our general objectives will be, by the end of the session, you will be able to explain the principles, strategies, teaching learning methods, assessment approaches, and support system which is required for the effective implementation of a competency-based curriculum in nursing education. Other than our specific objectives will be, I'll be explaining the importance and the need for competency-based curriculum in nursing education, describe the standards and the principles for effective implementation. We'll explain the key strategies for implementing a competency-based curriculum. We'll describe various competency-based teaching learning methods, discuss innovative pedagogical approaches, then explain the role of faculty as facilitators in competency-based education. I'll also explain the importance of continuous assessment feedback, then challenges and the enablers in implementing CBC, and also apply this competency-based teaching and assessment strategies to improve academic and clinical learning outcomes in nursing students. So what is competency-based curriculum? Yesterday, it was very clear what is curriculum, how INC has formed this curriculum, why INC has divided this curriculum into semesters, 6 months pattern. Now, why it is called as competency-based curriculum? Because here we are focusing on learner center, not teacher center. We are focusing on learner center. That is, competency-based curriculum is an educational approach that focuses on developing learners' knowledge, skills, attitude, and values required to perform tasks effectively in real-life situation. It emphasizes learner-centered education, practical application of knowledge, and achievement of specific competencies rather than simply completing a course or passing the examination. Like, it's very clear from the term itself, competency based. Why we are saying competency? Because we need to ask the students or make these students face the real life situations, how effectively they can face the real life situation. Just by giving a theoretical knowledge, they won't be able to. But it is not like कि हमने कभी पहले competency based education नहीं किया है. We also had yearly pattern. We were also competent, but as our generation is growing on, we need to develop competent nurses, because here what I can observe personally is students are only theoretical focused. They don't want to be competent. To make them competent, we have to apply many types of teaching strategies, so that we can include we have to make strategies to implement this competency based curriculum. So why does CBC matter? Because it brings theory into practice. It bridges the gap between classroom learning and real life application. Like I said, it is helping us to bring these students from classroom to the real life situations. It helps in active engagement. There, the students' participation becomes more. Rather than sitting and listening, just a lecture method cannot make the students competitive. They start having critical thinking, develop problem solving and analytical skills for professional challenges. Lifelong learning. What we do is remembered always. What we see is not always remembered. So lifelong learning encourages self-directed growth beyond the classroom. But it's very easy to say implement the competency-based curriculum, But to implement competency-based curriculum, you have to have a strong visionary leadership, which can drive the change. So effective implementation of a nursing curriculum requires strong visionary leadership to drive the change, comprehensive faculty preparation, and continuous intentional clinical integration. So implement this curriculum, you need to have a strong leadership quality. सिर्फ leadership quality होने से implement नहीं होगा ना. तो leadership quality, as well as we need to have good faculty who is being prepared comprehensively, as well as they can bring the theory into clinical practice. Then what are the key strategies? key strategies. First is, like I said, you have to have a strong visionary leadership. So change management and leadership, academic leaders communicating the vision and rationale for curriculum change to faculty and students. We have to first let the students and the faculty know why we want to have a competent based curriculum, or why we need to have this, why we need to implement this why we are saying this competency based curriculum is being important for the faculty as well as for the students. Next comes your curriculum planning and alignment. So basically, the INC has given you everything in your hands. You just have to follow them. If you follow them according to their protocols, you'll be easily able to implement it very easily. So aligning the learning outcomes, teaching learning methods, assessment, and competency mapping. We'll be discussing each and everything in detail. Then faculty preparation and development, continuous faculty training, educational technology, and innovative teaching approaches will definitely help us to implement easy implementation of this competency-based curriculum. Then competency-based assessment. So competency-based assessment basically is the standardized assessment tools we are following. That is 𝐂𝐮𝐸 and clinical evaluation, written examination. These all are standardized tools which will help us to evaluate whether our students are getting competent or not. Then simulation-based learning, students practicing clinical skills in a safe simulated environment. So before exposing your students in some real-life situation, first of all, we'll be giving them we will be providing them with a safe simulated environment, which will be very much related to the real life situation, so that they will not get stressed out. Case-based learning or problem-based learning, which we have already followed a lot many years before. Then skill demonstration and written demonstration, faculty demonstrate procedures followed by student practice and feedback. Then group discussion, seminars, clinical bedside teaching. These all create interactive learning among the students as well as the faculty, which will again help to enhance our teaching and learning practices. Then how we can structure and pace the curriculum. Like I said, आपके पास लीडरशिप क्वालिटी, आपको लीडरशिप होना चाहिए, आपको अपनी फैकल्टी को पढ़ाना है, आपको फैकल्टी और स्टूडेंट्स को बताना है, and thereafter what you have to do, you have to logically sequence and continuity of the units. So that also, it is being made up very easily. This INC has made the content also very organized into small units, and they have also made it very clear that in which unit what you have to do. So content should be organized into units that naturally build on each other to reinforce problem solving and critical thinking. Next is cumulative learning. Cumulative learning means what? Cumulative, हम all together एक learning कर रहे हैं, like plan reinforcement of essential skills over the years. Like in the first sem, if you're teaching these students bed making and vital signs, for the second sem, you'll be continuing with the same thing. So you will not be leaving that vital signs and bed making as first sem procedure. You have to continue with it, because it comes for the second sem for Foundation of Nursing 2, then for third semester Adult Health Nursing, then Adult Health Nursing 1 and 2. So it's being carried out. So what happened? Continuously we are reinforcing the same thing again and again. So what will happen? They will be getting more competent, and which will help to reduce the complexity which they are facing. For the first sem, they will be facing lots of issues even for a simple bed making procedure also. But as they will be going for the few further semesters, what will happen? Their complexity for that particular procedure will be reducing. They will be getting mastery over the skills. Then student-centric methods are being used. We have to think presently, we have to what our students need. If you will go and teach these students just deliver a lecture and come out, they will not use their brains. They are not going to use their brains, because they have their mobile phones in their hand. They have ChatGPT in their hands. They just want, they know कि अगर मुझे समझ में नहीं आया क्लास में, या मैंने सुना नहीं है, तो I'll just go and ChatGPT the content and I'll learn. Theoretical knowledge. What about the practical knowledge? So you have to make the students critical thinkers. For that, you have to engage the students in group activities, group discussions, active learning, and you have to teach them in theory-based learning, reasoning models. Like we have I'll let you know in the further slides. Like its example is given like Maslow's of Orem's theory. So Orem's theory states that you have to focus on, it's a self-care deficit theory. So you have to, how you'll explain that Orem's theory? They are not going to sit and listen to the theory and listen to the history. You have to make it in an interesting way. Either you can convert it into a role play, or it can a discussion method, or you have to first explain what you have to give a scenario. You have to present a scenario that a patient who has suffered from a stroke, who is not able to perform the personal hygiene independently. So what theory this Orum's theory clearly state that it's a self-care deficit theory. So here we have Oram states that it's the theorist emphasizes you need to help the patient in taking care of in self care. In you have to help उनको self care में help करके देना है. ये आपको उनको समझाना पड़ेगा. Now you have given the case scenario. एक patient है who is recovering from stroke and is unable to do self care. Now how you are going to apply this theory into this particular case scenario? So they will start thinking of. So what they will start thinking कि अब मुझे क्या करना है. You can divide them into groups, and then they will have multiple points in their mind. So first they will think they have to assess the patient's ability in their self-care. It can be oral care, it can be bed bath, or it's a bathroom bath, whatever, according to the condition of the patient. And then what will happen? You will discuss that condition in the class, and the group will be demonstrating the role play, or they will be explaining their points, and in group they will discuss this, and then the teacher will help to get them corrected कि कहाँ पे उनकी गलती हुई, where they have lagged this certain point, and then we can ask them what you have learned from this. So in this way, these theories will also help them in learning the things very easy. Then strengthening the clinical learning. So by providing adequate clinical exposure, ensure supervision by qualified faculty and preceptors, maintain clinical skill laboratories, use logbooks and skill checklists for competency tracking. Like I said, logbooks are very clearly given by the INC. Skill checklists are also being given by them. You just have to follow them. If you fall according to that, if you follow the checklist accordingly, you can easily achieve that competency tracking. Then continuous assessment and feedback. Formative assessment throughout the program you have to go on. Regular feedback sessions have to be taken. Reflective journals and portfolios. Competency-based practical examinations. Then e-learning platforms. Then use of technology. E-learning platforms, virtual simulations, learning management system, online assessments, and digital portfolios. Will be discussing everything in detail. Student support and mentoring, which is very important. Assign faculty mentors, provide academic and clinical guidance, identify learning gaps, and provide remedial support. Quality assurance and monitoring, which is very important part, whether you are able to deliver a competent curriculum, or whether you are able to maintain the competency of a student. This will be able to help out to know by assuring the quality assurance and monitoring. Regular curriculum review, student and faculty feedback, clinical audits and competency audits, monitoring achievements of learning outcomes. Then what are the standards of effective implementation? The first standard is competency identification. You have to first identify what you want from your student, what competency you want your student to achieve. So from there, your teaching starts. So competency should be clearly defined before teaching begins. So when you go to the class, you know that today you're going to teach with this unit, and when you look into the syllabus, it is very clearly mentioned what is the method you have to use for that particular procedure. So it's simple example. It's written clearly: medical surgical nursing. If I'm going to teach medical surgical nursing, actually it should be an adult health nursing. So they are going to administer medication safely. So what will be the performance indicator? You want your students should be able to verify the physician's order, calculate dosage accurately, follow the 6 types of medication administration, monitor patient response, document administration correctly. So how you will be able to know that whether the student has achieved it or not? Written demonstration, clinical observation, and OSCE station. So this is competency identification. First, you have to understand which competency you want your student to achieve. And then you have to explain it to your student that how you're going to check it, what are the things you are expecting from your student, and how you're going to monitor as well. So the other standard is Competency mapping. Like I have already said, what is competency mapping is you have your curriculum is being distributed with lots of competency, and that competency is distributed according to the curriculum. Is like from first year, for the first year, like first sem and second sem, you will be basically focusing on their hand hygiene, vital sign assessment. Why? And then one more thing is health assessment. Health assessment, why? Because in the first semester, they have already gone through with your anatomy and physiology. In the first sem, we are not teaching them with complete physical examination. In second sem, we are going with health assessment module, where they are able to correlate with the anatomy and physiology and their nursing foundation, and they are very clearly, they are clear with their things in the theoretical part. And now we are making them competent with these procedures. Then by the second year, they will start giving medication administration, IV therapy. And by third year, we focus on patient education. And by fourth year, there will be independent patient management. We'll be going for internship. Then third standard is what teaching and learning strategies you are going to follow. Teaching and learning strategies, you have to focus what your group wants, what competency you want the student to be achieved, and how you can make them competent in that particular learning aspect. So you have to decide what you want to do. So if demonstration or written demonstration, what will be the competency? We want this student should administer intramuscular injection. So first teacher may teach the procedure in skill lab, and the student will repeat the same procedure under supervision and will be doing the assessment as checklist based evaluation. This you can do in the fundamentals of lab or the skill lab which you have, and then thereafter they can go into the real life situation and do the same thing. So what are the strategies? Say problem-based learning, case-based learning, demonstration, re-demonstration, simulation-based learning, group discussion, role play, self-directed learning, peer learning, reflective learning, technology-enhanced learning. So with this, say in the slide, you can see the heading written is teaching learning strategies. So here, the teacher has actually given this. Why the teacher has chosen? Because the teacher understood that here the main focus is our learner, our students, not me. Not as a teacher, I have to think from my students' aspect, what they want, how I can make them more competent, how can I make them more competent. So first is problem-based learning. So a student learn by tackling real-life problems, developing critical thinking and independence along the way. You're giving them a problem and you have to make them sit and think what you can do. What is the present problem? How you can investigate? Then they will sit together with the groups and they will reflect and present it. This cycle guides students from identifying a real-world challenge to research, collaboration, and reflection, building a deeper understanding at each stage. For example, students are given a problem of increasing dengue cases in community and asked to identify the causes and solutions. So they will be presenting. Another example you can see here, a 55-year-old diabetic patient develops a foot ulcer. This is a simple thing. Now we'll ask the students to think about it. What the students will discuss of the risk factors, the nursing assessment part, the care plan, the patient education. So what competency you are making the child to achieve is their critical thinking, because they will start thinking what would be the cause of a patient who has developed foot ulcer. What would be the risk factors? What I have to assess? What I have to plan for my patient? What education I have to give? So these all brings critical thinking. They will start reasoning. Clinical reasoning will start. That why I'm asking patient education. So they will reason with कि अगर मैं उनको एक्सप्लेन कर रही हूँ कि आपको पैर में आपको डायबिटीज है और आपको हमेशा ध्यान रखना है कि आप शूज वगैरह पहन के चले, तो आई हैव टू एक्सप्लेन दैट व्हाई आई एम सेइंग कि क्लिनिकल रीजनिंग देना उनको आएगा. दे विल स्टार्ट कम्युनिकेटिंग बिकॉज दे आर सिटिंग इन अ ग्रुप एंड डिस्कसिंग. सो कम्युनिकेशन विल इंक्रीज एंड टीम वर्क विल स्टार्ट. Other example is like if you're taking community health nursing, this I have already said. The student will identify the causes, they will conduct community assessment, plan awareness programs, suggest preventive measures, and they will start what competency they will develop: problem solving skills, community assessment, and health education. So advantages, like I said, critical thinking and problem solving skill will develop. They will have good communication, they will have good teamwork, they will able to connect their knowledge to the real life situation, because going into giving them a community setup, it's very clear to them. Dengue fever is very clear to them. They know how can the conditions may be. Increases student engagement and motivation. So what are the disadvantages? It needs more time than the traditional teaching. Just teaching them कि डेंगू फीवर वाला केस आएगा तो आप कैसे उसको ट्रीट करेंगे, क्या हेल्थ एजुकेशन देंगे, ये हम लेक्चर मेथड से भी डिलीवर कर सकते हैं और पीपीटी प्रेजेंटेशन दे सकते हैं, लेकिन पर अगर हमने सोचा है कि हमको ये उनको क्रिटिकल थिंकिंग के लिए करना है, तो इट टेक्स मोर लॉट ऑफ टाइम. The student may need guidance in self-directed learning. Assessment can be more complex and effective facilitation is essential. Sometimes they misinterpret the things or misguide themselves. So you have to, again, the teacher have to guide them into a proper pathway. Then comes the case-based learning, which we have already dealt in our time also. So learner discuss and analyze the case scenarios to apply theoretical knowledge to practical situations. The advantage is what? They connect the theory with the real world practice, develop analytical and problem solving skills, encourages evidence-based thinking. Limitations, it is very time consuming. We need to have skilled facilitation. Students need strong foundational knowledge, and assessment can be challenging for us. Same, 55-year-old man presents with chest pain, sweating, and shortness of breath. What we ask the students might be thinking of the possible causes. They would review the cardiovascular physiology, interpret the diagnostic testing, develop a diagnosis and treatment plan, and discuss why other diagnoses are less likely. So here also the same thing happens, the critical thinking develops, because they have to clinically justify why we are saying this diagnostic criteria is better compared to the other. Next comes the demonstration. The instructor demonstrate a skill and students practice and perform the skill under supervision. Like a teacher demonstrate hand washing and the students repeat the same procedure and receive the feedback. Steps of demonstration is very clear. We have a preparational stage where we'll be arranging the materials and explain the objectives. Demonstration, perform the procedure step by step, explanation, clarify important points during the demonstration. Students practice, student repeat and practice the skill, and evaluation. Assess the students' understanding and performance. Advantages, makes learning concrete and practical, improves understanding of skills and procedures, increases student interest and participation, reduces errors during practice. So how when being a teacher, you demonstrate, the student observes and re-demonstrate you. So it makes more clear for the students, and they later on understand. If you'll ask the students what mistake you have done during this procedure, so they will be able to revise. Okay, I have done this mistake. I haven't done the procedure correctly. I haven't done the hand washing, or I have done some mistakes while calculation of the medication. So these all errors will be known to the students. So this will help in future. In future, they will rethink when they will be doing the same procedure. Limitation is what? It is same, time consuming, requires proper equipment and preparation. We need to have adequate space. We have to have good lab and teachers also, as well as, and large groups may have difficulty observing clearly. Next comes simulation-based learning. This is the latest thing which is being going on, simulation-based learning, and we are also trying to bring simulation-based learning in our college as well. So is a teaching learning strategy in which students practice skills, decision-making, and problem-solving in a realistic but safe environment that mimics the real-life situation. So this is very, very, very good for the students, because here they feel they are like in the real-life situation, where like if a patient is going into emergency condition, you will feel that really the patient is going into emergency situation, and you have to start with the CPR or start with the emergency treatment. So this gives a more competency. It gives more confidence to the students, and they will be more hands-on training will be more, compared to our labs, where we have mannequins and doing the procedure, demonstrating. It definitely brings skills, but the simulation-based mannequins and simulation-based environment gives more skills, practical skills, and decision-making capacity for the students. Then simulated environment helps students practice skills safely before applying them in a real situation. Like students manage a simulated inpatient experiencing cardiac arrest using a high fidelity mannequin. They assess the patient, perform CPR, administer interventions, and communicate as a healthcare team. Here, the patient will assess the patient, call for help, start CPR, use AED, and communicate with healthcare team. So what competency here the student is achieving is emergency response, leadership, and clinical judgment. Advantages, you are providing a safe environment for practice. Their clinical skill will enhance, their confidence will increase, critical thinking will increase. They will start having a good decision-making power. Then teamwork and communication will increase. This will also allow from mistake, learning from mistake without harming the patients. Limitation is what? This really require a large area, specialized equipment, and trained faculty, because to operate that simulators is really a big job. If you're trained in this, you can really apply it very easily. It's very expensive to implement, and simulation may not fully replicate real life situation. Next comes to group discussion, which we always follow. Group discussion is a teaching learning strategy in which a small group of students discuss a topic, problem, or issue to exchange ideas, share experiences, and develop understanding through interaction. Like I said, you're giving a particular topic, you're giving dividing the class in a group. You have in your syllabus, you can see every unit is being given a particular teaching learning method as well as assessment method. So how you have to do? So it's written clearly: group discussion, OSCE method, demonstration. So in which group discussion is being mentioned, you can create a group and ask the giving the students with a scenario and asking them to work it on, and they will actively participate. They will think, they will have multiple points in their mind, and they will present it. So the student learn best by doing, not just by listening. I have said it before also. Whilst listening, we can't remember. By doing, we will remember. So active learning puts learners at the center of the experience. Why it works? Because it improves the understanding and retention part, increases student engagement, builds confidence in communication. Then what are the steps? First, you have to introduce. A teacher has to first introduce. You can't just go into the class. Okay, today I'm going to teach this topic. Now, I will be dividing you into groups, and now you sit and discuss. You can't do that. You have to first, I have starting from the point slide I have said, you have to first ask your students or let your students know what you are expecting from them. So this teacher introduces the topic and objectives. They form the groups. Students will be divided into small group, and then discussion starts, where the members will be sharing the ideas, opinions, and information. And then this group will present what they have identified in front of everyone. And in the last, the teacher will summarize the key points. If in case any points have been missed out, the teacher will summarize and provide the feedback. Like prevention of hospital-acquired infection. The student will discuss the causes, prevention measures, and nursing responsibilities, and then present their findings into the class. Next comes role play. This we have done it a lot in our time as well as in present also we are doing, and it is very effective. Students act out real-life situations to improve communication, interpersonal, and problem-solving skills. Example, if one student plays a health worker, other plays a community member, and the health worker will explain the importance of hand washing to prevent a disease. This is just an example. Or else you can also have other topics also. So here also you have to explain, select which topic, what objective you are expecting, what roles you are going to divide them. Briefing have to be done. You have to explain the scenario and expectation to the students. What expectation, as if you're dividing the group, if you're dividing the roles also, you have to let them know what role you are expecting or what is the outcome you are expecting. Then role performance. Students start enacting the situation, and then comes the discussion part. And this discussion will help us to communicate among the other students. So here teacher and peer provide constructive feedback. Next comes the frameworks, which are the core pedagogical frameworks. If it say there are 4, that is behaviorism, which is a teacher center. Okay, behaviorism is teacher center, where the teacher is focusing on what I have to continuously instruct the students, what I have to, from what is my part, what I have to do for my students. Okay, so focus on direct instruction, repetition, and reinforcement. Like sometimes what happens if we observe, if a group of students or a class of students are not well skilled in some procedures, you will ask continuously to go to the labs and re-demonstrate it. Even in the hospitals also, you'll ask them to do the same thing. Why? Because in your mind, it's very clear that you want to make them skilled in that. Next is constructivism, that is learner center. Here we are giving we are building the student. Okay, the students build knowledge through experience and reflection, so learning through simulations and case-based scenarios. So here they will, constructivism from the term itself is very clear. They are constructing their ideas. They know what ideas they have to bring on. how they can bring their knowledge into practice, how they can present their knowledge into practice. Then social constructivism. Here, we are focusing on social interaction, collaboration, teamwork. So here, what we can do is group discussion, peer learning, role plays, the liberations. Liberationism, that is focus on freedom, critical thinking, and learner autonomy. Here, student will co-design projects and engage in self-directed inquiry. So we'll start. That is, till now we have learned about the various learning strategies, which how a teacher can implement, how a teacher can bring on the competency-based education for the students. Now, which there are certain models also, which you can also, which will also help a teacher to enhance the curriculum or bring that competency in the students. First is flipped classroom, art integrated learning, project-based learning, cutting-edge pedagogy, and critical pedagogical approach. So what is flipped classroom? You have heard this. Flipped मतलब उल्टा कर देना. तो पहले हम उनको active learning करेंगे outside as well as inside. तो active, first you have just presenting something like you have given a pre-class videos, okay? Before presenting any, if you take an example of OBGY, okay, OBGY, you want to present them with delivery, okay, procedure of delivery. So before the class, you have to give a small video, a small reading material for these students, and they will just go through it. They will come back to the class, and now they will be having some knowledge what you have given yesterday or the previous day to the students, and now that previous knowledge will help us also as a teacher and students also in actively learning. They will have their own ideas. They will also have their own questions in their mind. They will start thinking. So a pedagogical model where students first explore new content at home through videos, readings, or podcasts, and class time is used for active learning such as discussion, case analysis, or problem solving. So what is the key feature? Constructivist theory we are using here. We are enhancing the creating, evaluating, and analyzing skills. Like pre-class, a student watches a video of wound care and dressing techniques. It's an example. So in class, the students work in small groups to assess the mock patient. We can divide them into small groups, and even you can use the mannequins, and you'll be your groups will be assessing the patient. Okay, at first they will identifying the wound types, the performance of dressing changes under faculty supervision. So what is the outcome? First of all, self-study has been occurred, hands-on training they are learning, critical thinking, as well as active participation. So both your work is being done. You have taught wound dressing and wound care techniques also. You have involved the students. Now they're good in taking care of the wound care properly, able to do the dressing techniques properly. Next is art integrated learning. Like in some topics, if you feel like sometimes it's a dry topic and you want it to make it joyful or in like experiment, it's like an experiment only. Sometimes it work out, it sometimes not work out. So an experiential or a joyful method that integrates visual, performing, or literary arts into subject teaching to foster creativity and deeper understanding. So what key feature is connect concepts with artistic expression, encourage participation and creative output, supports holistic development through visual and performing arts, and strengthens the cross-curricular linkages. Like you are asking these students to make posters, okay, for posters, kids, street plays, public health topics like hygiene, tuberculosis, antenatal care, anything. So these all brings what happened, multiple things are going on. They can use audiovisual aids, posters, they are using various colors, skits, they are playing role plays. So these all what will happen, like this topic itself is art integrated. They are using their art to make that learning a joyful experience. So it enhances communication skill, community health awareness, and emotional intelligence. Next is the project-based learning. So project-based learning basically connects theory with real life application. For every semester, for every subject, you have to give students group projects. And that group project really makes the students interesting learning. They develop for the students, for a particular group of 5 students or 10 students, that project is really helpful. they learn that project very well, and that project is being presented in front of the other students. So what happens, what ideas they have put in the project is being reflected to the other. They start correlating with the real world. They have their own ideas, which that ideas they express it to the others. They also start thinking, okay, this is the way, okay, this is the correct technique, and that helps the other students also remember the things. So a teaching learning approach where students investigate real world problems and present solutions through a structured project over time. The key features are collaborative, reflective, real-world focused, enhance lifelong learning and problem solving, utilize digital tools for engagement, encourages teamwork and self-directed exploration. Like students conduct a community-based project on maternal health awareness. So they will conduct surveys, health education sessions, data analysis, present findings to peers and local health workers. So develop teamwork, research skill, leadership quality, and they are able to apply the theoretical knowledge to real context. Next is cutting edge pedagogy. So this is innovation driven and tech enabled learning. Innovation driven by and tech enabled by because it's an innovation. You have to engage these students in learning. You have to also focus that you have to complete your whole 6-month syllabus, trying to get the syllabus completed by within 5 months so that you have adequate time for the revision also. You have adequate time to complete their assignments also, and there too you have to make them competent as well. So innovation matters, and you have to be techno friendly as well. They like digitalization. They want everything to be digitalized. If you will give them online notes, if you give them online videos, especially videos matter to them. They love enjoying the videos. So videos, even though enjoy, that sometimes that points get inside their mind. So this pedagogy that integrates advanced digital tools, simulations, AI, and other emerging technologies to enhance learning and enhance teaching and learning. Then what are the key features? Integrates emerging technologies in instruction, addresses diverse learning needs through interactive platforms. There are lots of interactive platforms such as this peer deck. I have already mentioned here peer deck. So what happens? It's a platform where you will be able to get lots of modules, or you will be able to give them assessment. Okay, like you have logged in, then you are giving something for you have prepared some matter, you have asked them to prepare it, you have to just go through it, and then assessment start. You will have you have placed some questions, you will be they will be involving them in that questions. They will solve that questions, and then that either it will give you a result, and or later on that tutor will also help to know where your mistakes have been done. Okay, so it's a type of learning management system where you are giving digital platforms. There are various digital platforms which help us to deliver, monitor, as well as assess the learning activities. It helps in blended learning, like you are making the learning easy for them, as well as you're making them competency based education also, because you are involving this AI technologies as well as. So there are various platforms like Moodle, Google Classrooms, Canvas, or Blackboard Learn. There are multiple. So they help to make the students think competently also, as well as increase the competency. Like if example I say you want to make the students administer medication safely. So what can you do is you can just put some this faculty can upload the videos and some reading materials and drug administration guidelines, and then what the student will do a pre-class quiz will be also mentioned there. They will solve that, and then what happens during the class, when this next day the teacher visits the class, she will demonstrate the procedure of administration of medication. She will also discuss there the medication errors which can happen, the patient safety protocols you have to follow up. And then after the class, the student will be asked what reflective learning you have done. Reflective learning means what here? You will ask the students what you have learned from the video what you have understood, from the reading material what you have understood, and now your teacher has demonstrated it. Now what you are thinking, how you know that whether the procedure what you have thought of is really correct. You have points, right? I have to focus on the safety measures. I have to think of 6 rights of drug administration. Then better preparation that student will identify. And then what happens after the class, student will again will appear for the post test feedback, and then for post test quiz will be there, and then the student will solve it. So here the student will be able to learn the procedure also. Here the teacher is also teaching, and the students are also learning by this tech-based, tech-enabled learning. So foster digital literacy and innovation mindset. Next is cutting edge pedagogy. Here what happens is you are giving virtual simulations of nursing procedures like insertion of IV lines, catheterization, or CPR training. So tools like AI-based drug calculators, online diagnostic case simulators will also help in clinical decision making. So what is happening here? They will enhance the clinical preparedness, digital literacy, and accuracy in skill application. Like example, like this approach what encourages the learners to question norms, engage in reflective dialogue, and understand the why behind what is being taught. Why we are saying that you have to follow this procedure, why we are saying that you have to follow the rights of drug administration. So why is being taught here? So encourages inquiry, what are we learning and why we are learning this. Fosters discovery, investigation, and analysis. Learners actively construct knowledge, promotes questioning and deep reflection. So next is modes of teaching and pedagogical approaches. First is multimodal teaching for holistic learning. So there are multiple: offline like face-to-face, online synchronous and asynchronous, blended. We are combining both online, offline. I have already discussed this. Each mode tailored for different learning outcomes and engagement levels. Face-to-face interaction, उसमें बहुत सारे टाइप्स है हमारे पास: cooperative learning, brainstorming, group discussion, role play, which we have already discussed, field work, case studies, storytelling, problem based and solution based learning. What is jigsaw method? Here, this jigsaw technique divides a topic into parts, and each student or a group will be becomes an expert for their part, which we also had in our time. Like our teachers will be dividing the students into groups and will be giving them some topics, and these topics further will be a big topic. Small topics getting a big topic. Like example is divide the class into small home groups, stages of healing. तो हम स्टेजेस को ही डिवाइड कर रहे हैं, इसका सब टॉपिक है. हीमोस्टैसिस एक जन पढ़ाएगा, इन्फ्लेमेशन एक ग्रुप पढ़ाएगा, पॉलिफरेशन एक पढ़ाएगा, मैचुरेशन एक पढ़ाएगा. एंड देन दीज एक्सपर्ट they are terming it as expert group because they will be expert in teaching that particular part. So expert groups will be teaching them and discussing this topic in front of the whole group, and this will be further assembled, and in the last the teacher will be summarizing it, the whole thing. That is jigsaw puzzle. Next is think, pair, and share. This we also discussed. It's a collaborative strategy. You are thinking, a student thinks independently. You're not dividing into groups. Now we are talking about the groups, but here we are not discussing about the groups. Here individual students will be there. They will be thinking independently. They will be paired up with their partners. Then they will be paired with the partners. They share and among themselves, and then they will share it to the class. Here, what should be included in discharge teaching for a post-operative patient? Like it's an topic. So student will start thinking, they will discuss answers with their colleagues, and then they will finally pair their share key points with the class. So what will happen? Same thing. Critical thinking, their communication skill will improve. Inclusive strategy, everyone will start participating. It's useful for case discussion, ethical dilemmas, or clinical decision making. Now comes the challenges and enablers. So challenges are basically for both, for teachers also as well as for students also. For faculty, sometimes faculty resistance can occur. And that faculty resistance, why it happens? Because we are not adequately trained, of how we have to involve these students, because we have a lot of students and we have to focus on everyone. When we are saying competency based curriculum, so you have to make everyone competent. Yesterday itself, one of our participants asked that how you will say the student has got competent. We are saying we are giving the we are doing the assessment part. Like, correct, it's assessment, so you have to do assessment of each and every student. You can't do the assessment of a single student. So assessment is a difficult part. It's a time taking process, but if you have good faculty, you have good trained faculty, then definitely it's very easy. Then infrastructure issues, you need to have good number of mannequins. If it's a simulation based, it's very good. You need to be techno friendly. You should know all the new technologies where you can use this AI technology, in which topics you can use AI technology, how you can prepare it easily. Within minutes you can prepare it. Then student preparedness is also required, because you have to first explain them why we are doing all these. First of all, what I faced is, when I joined here, our students, this was the first time for me to have semester in the college. So for me in the college, so semester, when I thought, when I saw the this curriculum, I thought, okay, I have to go this with, I have to complete the whole syllabus within 5 months and 6 months. How it will be possible? I have to complete the micro teaching, seminars, group projects, everything. And later on, I understood this micro teaching, seminar, these all things are indirectly giving us the competency based curriculum, making the students competent. So you have to just think of in which unit, which part you have to take off, in which unit, what OSCE, whether you have to go for OSCE, for skill labs, because skill labs are already very clearly mentioned. 40 hours you have to go for skill lab, or 80 hours you have to go for skill lab. So that adequate time you are already getting to complete your OSCE. You're able to do the assessment part also. So student preparedness required, because students get tired because of constant OSCEs, because of constant micro teaching seminars. So you have to make them understand why we are doing this, and sometimes you have to mentor them also. Then what are the effective teaching strategies you can increase to increase the competency? Like this we have already discussed, I'll not go in detail. So that is student centered learning. I said you have to always focus on student centered, what student want, how you can make the student work on it, how you can make the students practice better. So strict shift from instructed led delivery to active student participation. When students engage directly with content, they develop deeper understanding and stronger clinical reasoning. Like in group discussion, they are very happy. In the labs, they are happy. In the simulation lab, they are happy, because they start actively participating. They start critical thinking. Like group discussions, problem-based learning, playway method, case-based teaching, and project-based teaching. Next is collaborative. Collaborative means same thing, group projects. Okay, so students develop communication, teamwork, and leadership skills through structured group work, essential qualities for nursing practice. So like group projects you can give here, the student will basically work for our community setup and all. We'll have good community health initiatives, dividing the roles and presenting the findings, and they find it very easy, as well as it goes directly into their brains that, okay, if this happens in this, if this happens, you have to do this. Next, interprofessional team simulated team can be developed scenarios which will be same like the real life situations. Like like I say, this we have done this in our college as well. Like if the topic is human digestive system, okay. For the first sem, it's anatomy and physiology, then nursing foundation. Then for the second sem, what happens? Second sem, they go for applied biochemistry, nutrition, and nursing foundation 1 and 2. So for the first sem, we teach human digestive system. So anatomy teacher will be teaching the structure and the functions of digestive organs. So next, when they come to second sem, the biochemistry is teaching the role of enzymes and the chemical digestion. It's physiology they have learned, and then they are here, they are learning the biochemical things, what is being happening. Now we then in the start, what happened? The students were getting very confused. Here, I'm telling about my part. The students were getting very confused. They were not able to correlate. Then we thought of, again, we revised it. We in one class we started with the revision of digestive system, And then in the second class, we'd gone with the biochemistry teacher. And for the third class, we conducted a joint class where they were able to correlate with the topics. बिकॉज दे वर नॉट एबल टू आइडेंटिफाई कि ये बायोकेमिकल रिएक्शन यहाँ हो रहा है, तो फिर ये साइकिल कहाँ पे बनेगा, ये अच्छा ऐसा हो रहा है क्या, ये कैसे डिस्ट्रीब्यूट हो रहा है. तो यहाँ पे दोनों टीचर्स ने मिलके उनको को रिलेट करके पढ़ाया. एंड द सेम थिंग वी डिड इट for both our semesters also, first sem and second sem, because they were finding it very hard to understand this biochemistry. So this has really helped us. Then inclusive teaching environment, like the material should be very accessible. Every student deserves equitable access to teaching. An inclusive approach ensures diverse learners across backgrounds, abilities, and styles can all thrive. So the material should be accessible for everyone. If you're giving written, visual, or audio visual materials pre the class, everyone should have that access. Culturally responsible, you should respect and acknowledge the diverse backgrounds in all the teaching content. Equitable participation, you have to make it in clear that every student participation is required. And flexible approaches, you can change the methods. If you like the role play to be role play cannot be adapted for all the units or all the subjects. You have to change it. So flexible approaches have to be maintained or taken care of. Like during a nursing skill demonstration, the teacher forms mixed ability groups and ensures that every student participates in the practicing procedures, discussing cases, and asking questions. Additional guidance is provided to students who need support. Then continuous assessment and feedback. This is most important. If we will not continuously assess or take feedback, we won't be able to know whether our teaching strategies are being worked out or not, or whether they are learning it strategically or not. So regular structured evaluation paired with timely specific feedback helps students identify gaps early and build on strength and progress. So weekly quizzes can be conducted. Short knowledge checks with immediate feedback. Targeted guidance can be done. We can give personalized comments on performance and areas to improve. Next comes the reflective learning. So reflective learning means what? Gaining new knowledge through active participation. It improves critical thinking and decision-making skills, develop teamwork, collaboration abilities, enhance communication, presentation skills, connect theoretical concept with practical applications, identify strengths and areas for further improvement, and increase confidence in independent learning. So what is that? From road to reflective learning, like from teacher-centered to learner-centered, passive reception to active engagement, content heavy to competency focused, and individual task to collaborative learning. So बेसिकली जो हम टीचर ट्रेडिशनल मेथड यूज करते थे उससे अभी हमको रिफ्लेक्टिव में आना है, वेयर यू आस्किंग द स्टूडेंट्स टू थिंक ऑफ व्हाट दे हैव लर्न. Okay, like for example, our competency here is medication administration. Okay, so what experience happened, what experience a student has happened, now he or she has to write it down. That is reflective thinking. Okay, so like the student is writing, during my medical surgical clinical posting, I administered oral medication to a patient with hypertension. Okay, so reflection here, what the patient, the student the INC competency, what they focused on patient safety. So the student is writing, I verified the patient, but initially missed the checking the expiry date of one tablet. So here one point is being focused by the student itself. Next, my clinical instructor corrected me and explained the importance of all 6 rights of medication administration. Then I realized that even small omissions can affect the patient safety. So what is the learning outcome here? That improve the understanding of safe medication practice as per the INC competency standards. And future action, in future, when the student will go for medication administration, the student is going to follow all the rights of drug administration. Next comes the mentoring, guidance, and positive reinforcement. This is very important. Even though we have lots of checklists, we have a lot of assessment criteria, we have a lot of teaching strategies, still you have to mentor and guide the students as well as the faculties also, so that positive reinforcement is being maintained. So individual faculty support helps students navigate academic and clinical challenges. Regular mentor meetings create accountability and build confidence. Like a faculty mentor identifies a struggling student early and then co-creates a targeted improvement plan. That is, our mentor will be there and mentor will be mentoring the 10 or 15 students, and then they will be able to know whether which student is facing this problem, and they will be mentoring and guiding them. Then positive reinforcement is very important. Motivation is very important for present batches or the present generation which is coming on. Recognition of achievement. Even though they achieve a small thing also, you have to recognize them. Sustain effort and builds a growth mindset. They will start growing. They will feel like, okay, I have done something good. If us, even for a small procedure also, if they did a good thing, or when re-demonstrating, they have didn't do any mistake, you have to give a positive reinforcement or motivation. This will help them to grow more, and this awarding certificates and public acknowledgement for excellent clinical performances. Now, role of a facilitator. What is the role of a facilitator? As a teacher, what you have to follow? You have to create a positive and engaging learning environment. You have to you have to take care that every student is actively participating. Their discussion and their points are also given importance, and which will help in critical thinking through questioning. They being supported with collaborative learning, and their team helps them out. They are being provided with constructive feedback and clarification. If they have done something wrong, or if the points is getting wrong, you have to give them a constructive feedback where you are asking, or you're giving a clarification that why their point is not correct. You have to clinically justify it. Then motivate the students to explore and learn independently, assess learners in achieving desired competencies. Then what are the assessment methods? First is formative, which is being the feedback taken during learning. Then summative, that is evaluation at the point, and OSCE, structured clinical examination, and viva voce, that is oral examination. Formative assessment, because it is very important day to day, or even after completion of one unit, you have to do the formative assessment to know how much your students are getting competent, or how much the students are learning from that particular unit. If you feel like if the students are not able to learn, you have to change your learning teaching pattern. Okay, so formative assessment is conducted throughout the learning process to provide timely feedback and identify gaps. Like there are various types of quiz are going on. A quiz can be conducted like Kahoot. It's a online, it's a digital one. Okay, AI. So what is that? Usually what students have, like kabhi unko kuch question पूछ रहे हैं. You might have also seen this in some conferences and all. What they do, they will give you you have your mobile phone access, and that access is being given to you by that particular group. So what they do, they will be pointing out questions in their screen, and you have to give the answers, and randomly you're giving the answers. Your name is not being mentioned. You are giving the answers. Okay, the students are being answering there from their mobile phones. So what happens, they are not being pinpointed. Here it's a play way method. Like it's हम enjoy भी कर रहे हैं, instantly teacher उसको answer भी दे रहा है, feedback भी दे रहा है, और यहाँ पे एक enjoyment भी हो रहा है, plus हमारा quiz competition भी चल रहा है. तो इससे क्या होगा, students will be able to, students feel sometimes weird or awkward that every madam is pointing out me that I have given the wrong answer. So this can be done if you want to have a rapid fire quiz. This student activity which like you have given a questionnaire, and in that question you are given the 4 multiple choice questions, and then you have to answer any one. Then summative assessment, which we are already conducting, every university is conducting it. So this first 2 assessments are being carried out in the collegiate level, and then the final summative assessment at the university level. So summative assessment evaluates the overall competency achieved at the conclusion of a course or a module. It determines whether learners have met the required standards of progression or certification. So like I said, INC has given it clearly. Okay, so module is also one type of assessment only, or learning strategy. Okay, while doing or while completing a module, the students are learning everything. Like if you're talking about a health assessment model, okay, so that is a mandatory model, they have to complete it. So when health assessment model is being given, they are being divided into groups. Now they have to present them. Okay, so it can be their choice how they want to do the module part. So when they are doing it, they are achieving it. Okay, they're learning thing. And the last, they're getting a completion module certification. That is that they have completed with this module and now they are very skilled in doing the health assessment techniques. So like at the end of a unit on human anatomy, students take a final written examination, copying all the topics throughout the course. The nosky, this is very common for everyone now. The objective structured clinical practical examination is the gold standard. It's actually considered as the gold standard for assessing the practical and clinical skills. Students rotate through the standard stations, each targeting a specific competency under controlled observable conditions. Yesterday also madam has said it. You can divide it. Like not all OSCE stations are to be considered of. Like it can be observed and unobserved. So you have to decide as a teacher that which all stations you have to observe, go for all the observation and the assessment part, and the other one not for the assessment part. So at an OSCE station, a nursing student is able to measure a patient's blood pressure within 5 minutes, and the examiner observes the procedure using a checklist and award marks for each step performed correctly. Then the Viva, which will help us to know the knowledge, the depth, and the clinical reasoning and the communication skills which the student has achieved. Okay. Then concluding with this particular topic, that is implementation, this we have to follow the domains: knowledge, skill, communication, professionalism, and leadership. So if you're talking about knowledge, if you're saying drug calculation is the knowledge, the skill will be IV canalization. Communication will be patient counseling. Professionalism, how you're maintaining the ethics. And leadership is what? The team coordination which you're following. So basically the competency domains in nursing is this only: knowledge, skill, communication, professionalism, and leadership. And you have to divide your competency or the competency you are needing from a student into these domains and asking them. You're explaining them. So if I am teaching you about the drug formulas, so that is your knowledge part. But your skill is how you will do IV canalization. And your communication part should also be important, that how you're counseling the patient that you're going to do IV canalization. Then professionalism, what ethics you're following, what all things you have to keep in mind, what are the professional things you have to keep in mind. Then is the leadership quality, because without a team, you can't work. So leadership qualities to be developed. So that is the competency domains in nursing. Now, my next topic is mentoring of nursing students for academic and clinical excellence. So mentoring, everyone knows, it's a supportive relationship. So this is a relationship between an experienced nurse and a nursing student. Why I'm saying experienced nurse and a nursing student? Because we as teachers are also experienced nurses, and we are developing a supportive relationship to develop these students, helping the students in academic learning as well as clinical practice. We are giving them guidance, encouragement, professional support throughout the learning process. We are enhancing their knowledge, clinical skills, critical thinking, and decision-making abilities. Mentoring helps students gain confidence, develop professional values and ethics. It bridges the gap between classroom teaching and real-life patient care. Like I said, it's a relationship. It's a supportive relationship, actually, between a student and a nurse. So what is the importance of mentoring in nursing? It enhances academic achievement, because students need guidance from the mentors, from their teachers. Teachers are their mentors. Now they need how they have to grow in academics, as well as how they can improve their learning performances, how they can improve themselves in each semesters. This brings clinical competence also, academic as well as clinical. In clinical part, the clinical instructors are going with them, they're helping them, they're guiding them, they are continuously doing assessment part, whether they are able to do the procedure skillfully, they're able to give clinical reasoning, why this procedure they have done, why they have to implement it. That is developing clinical competence. Next is build confidence and self-efficacy. This helps when we motivate the students. When a mentor motivates the students, this itself gives a very good confidence for the students, that they have someone with them. They have the support system. I know that if I did something wrong, I can immediately go to my mentor and can I share, and she is going to help me out. Next, it helps in promoting critical thinking. That is, mentors encourage reflection analysis, evidence-based decision making. Here what happens, if example, the student is very sad that he or she has not done the procedure perfectly in this clinical part. Okay, now he or she is going to go to the mentor and say, I'm very disheartened that my madam has taught me very nicely, but I was unable to do the procedure perfectly. So what happens, here the mentor is not going to scold, why did you do, why, it's your part, you should have done this, your madam has done this. No, here the mentor has to guide them that, okay beta, you have done it wrong, it's okay. First thing is, it's very good that you have understood that your part is wrong. Here itself the reflection is going on, that the student has understood that where he or she is being wrong. Now you're giving them a guidance that, okay, here you should have done this, this is evidence based decision making, you should have done this. Now it's okay, now you have understood that your part is wrong and where you have to improve yourself. Now the next time when you do the same procedure, you have to think critically and do the procedure. Then this facilitates professional socialization. Here the student will understand the professional roles, values, and ethical practice, because he or she is observing her mentor or his or her mentor, how she is she following the professional values, is she following the professional rules, that she because a mentor and mentee is a professional relationship, not a personal relationship. She has to be mentor, and that mentor itself should follow the professional rules, and that professional rules will be followed by the mentees. It helps in providing emotional support. The students get stressed out, especially during the first semester when they come to the college. They are in new environment, new classmates, new teachers, new college, and they have lot of things to study. Semester system with lots of, and the for the very first day, with the introduction part itself, we start giving them with the assignment part, and we let them know this is micro teaching, this is your seminar, and now we'll be doing the OSCEs and everything. So they are stressed and they are facing a challenge. There's a challenge for them. So when the mentor guides them, it relieves their emotional stress and their personal concerns as well. This, either though I said it's a professional relationship, sometimes it gets into personal when a student from a random of 10 students, one student comes and says some personal things to personal concern to the mentor. The mentor cannot deny it. He or she cannot say I can't help you with this because it's not professional. He or she has to go beyond that professional part and help her out from the personal concerns, because some or the other time this personal reasons can create problem or stress for the students in learning aspect as well. Then bridge theory and the practice, like connect the classroom learning with real life clinical teaching. It helps in lifelong learning. Then it also helps to improve patient care quality, because well-mentored students provide safer, competent, and compassionate care. Because if your student, if your students are competent, they will be compassionate with their care, they will be able to provide safer environments while doing procedures. Then prepare future nurse leaders. You are preparing a future nurse leader who is actually having a good leadership quality, who is well competent, because today's world needs a good, competent competence to enhance, to build confidence, to develop critical thinking, to foster professional values, to provide emotional support, to promote self-directed learning, to bridge practice, to improve academic and clinical outcomes, and to prepare future-ready nurses. Then what is the role and responsibility of a mentor? While supporting for the academic part, you have to guide the students in study planning, especially when the students go into 5th semester, 6th semester and all. They are quite aware of their strategies. They know how they have to plan it out. But when it comes to the first sem students and the second sem students, the first year students, they are quite lacking that part. You have to understand the students' concept. You have to understand how you have to help them in planning their study portion, like how they can study for their exams, how you can help them in gaining knowledge from the class, as well as how they can prepare themselves for their examination. You have to help them in understanding the difficult concept. You can't say like, okay, this subject was taught by some other teacher, so I won't be able to teach you. No, you as a mentor, you have to be ready for everything. You have to help them out with the different concepts, difficult concepts they are having. Then examination preparation. This is the most important part, and a mentor have to be ready with all the strategies and how you can help them. And this mentor alone cannot do. So mentor have to give up, have a good coordination with the class coordinator as well, as because you as a mentor cannot take a decision. You have to involve the other faculty also. You have to involve the class coordinator, the subject coordinator, so that you together can prepare an examination preparation, a checklist how you have to go with the process. Then monitor their academic progress. So every like formative assessment is being carried out, but this formative assessment itself is being taken by the individual teachers, okay, the subject teachers. So you have to monitor it as a mentor. You have to also check whether their academic progress is getting good or bad. Then clinically, you have to help them with clinical procedures. If they have any problem with supervising the patient care activities, clinical reasoning, decision making. Sometimes they face problem while going to the clinicals. They have difficulty in talking with the teachers they are having, or sometimes they feel like I won't be able to ask to them. They have some resistance. So they come to the mentors, and you have to you have to focus on clinical reasoning and decision making skills. Professional development. Here you are focusing on encouraging the professional values and ethics they have to follow, develop leadership and teamwork skills, promote accountability and responsibility. Emotional support, how you have to listen to the students' concern rather than just getting a mentor-mentee meeting and just going on with your problem, with your statements, not asking what the students are actually having. Like I have said, it's learner centered. Similarly, this mentoring is also a learner center where you're focusing on students' problem. You are preparing yourself, you're planning something, you're collaborating with everyone, and you're acting out. Okay, so emotional support to be given because the students are having their own concerns. It might be small concern, which might be like a student, a teacher has scolded them, but it has created a lot of problem in their mind. They're stressed out. So you have to listen to the student concern. Then you have to understand the student that no, I have to here I can't go with the professional values. Now you have to take into a deep thing. आपको समझाना पड़ेगा कि नहीं ये क्यों आपको डांटा गया था, रीजन क्या है, इसको आप इसको इस तरीके से सोचो, इस तरीके से समझाएंगे और उनकी एबिलिटी कितनी है समझने की, ये आपको समझना पड़ेगा एज अ मेंटर. एंड देन अ प्रॉपर मोटिवेशन एंड एनकरेजमेंट विल हेल्प आउट. Then qualities of an effective mentor, like I said, you have to be very approachable and friendly. Friendly doesn't mean that they are so friendly with you that they are taking it you for granted. No, that relationship should be a professional one, but it should be so friendly that you are being approachable for their mentees. Then you should be a good communicator. You should know how to talk to them, how you can ask the questions, how you can get out the points from their side. The mentor should be competent and knowledgeable, should be supportive and encouraging, patient, understanding, respectful, non-judgmental. This is very important part. But what happens is when a student shares some problems with you, you start judging them. If the student says, I'm having some type of like I have some guilt, or like like a student have said, I don't like the teacher, okay, because I like you, you are very good, I like ma'am, you are very good to me, you understand me very well, but my class coordinator, I don't like my class coordinator because she's not so good, she don't understands me, she scolds me. So what happens, you make them understand, okay, very good बेटा, आपने मुझे बताया, ठीक है, पर ऐसा नहीं है, मैडम आपकी अच्छी है, आपको समझाती है, ऐसा नहीं है, आप मैम को गलत समझ रहे, मैम का पार्ट ऐसा नहीं होगा, आप समझाते. लेकिन later on you get judgmental for them. You start judging the students that okay यार इसने ऐसे क्यों बोला. Same can happen with the other mentors also. They will then all mentors will come and they will share the problems, but that is wrong. You have to maintain the confidentiality, what your mentees have said to you. And because of this, just judgmental mentors, when they develop, when these mentors together come and sit and discuss about the problems what they have heard from the students, and they will start judging the students. अरे इसने कॉलेज के बारे में ऐसे बोला, इसने वो मैडम के बारे में ऐसा बोला, उसने ये बोला कि मुझे ये सब्जेक्ट समझ में नहीं आ रहा. This is wrong. So you have to be non-judgmental because they are sharing your problem. They are their problems to you just because they trust you. You should be a role model. Then provide constructive feedback. You have to provide feedback properly, trustworthy and reliable, empathetic and caring, accessible and available, and promote critical thinking. Then academic excellence, this I have already explained you. Guidance for academic mentoring, this also I have explained you very well. Then clinical excellence, how they will mentor, how you will be able to clinical excellence through mentoring, how you will be able to develop a good student, a good clinical mentor is you have to enhance your practical skill also, because without your knowledge, without good practical skill, you won't be able to improve clinical judgment, increase confidence in patient care, promote adherence to standards of practice, and develop professional competence, because a mentor shapes today's nurses and tomorrow's leader. This is the same thing I have already told this before, that clinical activities which you have, which will improve the mentoring, is bedside teaching, demonstration, case discussion, return demonstration, reflective practice and assessment and feedback. So then last, I'll conclude, that is challenges what a mentor can face is lack of time, because we have a lot of students, we have a lot of work as well as, so balancing is difficult, heavy workload, limited clinical opportunity. Sometimes you may not be able to go, or sometimes it happens the students are not getting adequate clinical experiences. Communication barriers can happen because of language difficulties. Different this I had in the earlier part when I was not able to, when I had problem with Marathi language, but later on I adapted to it. Then different learning styles, inadequate mentor training. You have to also train the mentors. What are their expectation as a leader? What you're expecting the mentors to deliver it to your mentees, and then the student stress and anxiety. Then what are the strategies? How can improve the mentoring is good mentor training programs. You have to conduct regular mentor mentee meetings, even though you're very busy. You have to have a good communication. You should set a goal that this time you're going to focus on academics or clinicals or their performance or other critical thinking part. Continuous feedback is to be needed, taken care of. Supportive learning environment to be given. Use of technology is very good. Clinical exposure, recognition and rewards, and regular evaluations to be done. So if you are going with effective mentors for students, academic performance will increase, improve the clinical competency, confidence will improve, motivation will be there, professional growth will be there. For institutions, student satisfaction will be higher, and that is what needed for institution. Better learning outcomes will be there. This improve the quality of nursing education we are increasing. Then for health organization, competent nursing workforce, improve patient care quality, and enhance patient safety. So here I conclude with the topic, that is mentoring, like I said, is a supportive relationship, and this you have to maintain as a mentor and mentee. This relationship really helps out the students in growing up from a very zero level to a very high level. And so here I finish off with the topic. So educating today's learner to become, just a second. So educating today's learner to become tomorrow's competent and compassionate nursing professional. So here I hope I have justified the topic. I don't know. I'll ask the chairperson.
Thank you, ma'am, for your wonderful session. With this, we come to an end of today's insightful session on competence-based curriculum. We had learned about the importance of CBC, its principles, innovative teaching learning methods, different frameworks, the role of a faculty as a facilitator, and the significance of continuous assessment and feedback, and the mentoring, how the mentoring helps in clinical settings as well as in the academic areas. This learner-centric approaches plays a vital role in developing competence and confidence in nursing profession. Thank you, ma'am, for such a wonderful practical insight and empowering sessions. Your experience and expertise in curriculum implementation and student mentoring have given our participants a valuable tool to carry back to their institution. Now, I invite the participants to share their questions or in the chat box.
Also, they can raise their hands.
Participants are requested to raise their hands.
Reena Habli, you can unmute yourself and ask question.
Participants can ask their question. Miss Reena Habli. Ma'am, you can ask your question. Uma Devi. There is one question from Zankhana Patel. Do we need to be more competent for teach these students? So I want to ask you that if the teacher is continually work in the academic side from the years, then what is the future policies which should be made for to improve the clinical skills of the teacher? As is dual role in hospital and academic side is good option, ma'am?
I'll go through the question, ma'am. As you said, we need to be more competent for to teach the students. So I want to ask if the teacher is continually working in the academic side from the years, then what is the future policies we should make to improve the clinical skills of a teacher? So, ma'am, to teach these students, you have to be competent. I said it very clearly. So, for teaching, if even though you are in the academic part, you have to get updated. You have to get updated for the with the clinical skills also, because without clinical skills you can't be a good teacher. You have to have good clinical knowledge regarding the present, what clinical things are being going on. You should be able to know. If you're not knowing, you won't be able to teach this semester system. Semesters need to involve lot many things, ma'am. If the modules, you have to make them prepare these modules and all. You should first know what is to be taught to the students. I said it's the student centered approach. So to know the student centered approach, you have to first have a good adequate knowledge regarding the particular thing. Without knowing, you won't be able to teach them, ma'am. So you have to continuously get updated for about the clinical things.
Thank you, ma'am. Anyone else want to ask anything? Okay, let's conclude the session.
I just want to clarify one thing. The question is asked whether the dual role is acceptable or not. It depends on the faculty and the facility available on the in the organization, because many times it's happened that if we are going for a dual role, we have a multiple more responsibility at the clinical side. So if we are fixing the dual role, we have to be clearly justify that what job description we are having in a clinical as well as in a teaching learning process, because you have to offload somewhere to the people who are practicing dual role.
Thank you, ma'am.
Thank you all the participants for your active participation. So tomorrow we have a very significant session on academic evaluation in the semester system. For tomorrow's session, we will share the semester syllabus in the group. Kindly go through it and prepare with your thoughts and queries. Have a wonderful evening. Thank you. All the participants are requested to kindly turn on your cameras for the group photo.
Okay, it's done.
Lastly, I just want to say one thing. Thank you, Shrija ma'am and Rakhi ma'am, as well as Yasmi ma'am for giving me this opportunity to again stand in front of you and present something. Really, thank you so much, ma'am. And I hope I have justified somewhere, some point. I know I can't justify fully, but I have might be.
Yes, you have done it very nicely.
Thank you, ma'am. Thank you so much.
Thank you, Sharanya.
It was very elaborative and very clear. Thank you so much, Sharanya ma'am.
Thank you, Rakhi ma'am.